Dear listeners, welcome back to the ASEF podcast. My name is Jakub Timothy Stojano Konda, ASEF Fellow 2022 and host of ASEF series Insights from the Top. In this series, our goal is to chat and get inspiring insights from well-known and respected Slovenian leaders and entrepreneurs who share with us their thoughts about their core values, lessons learned throughout their careers, and their vision for Slovenia regarding their field. ASEF Podcast is part of ASEF, or the American Slovenian Education Foundation, an organization that aims to enhance American and Slovenian educational activities and unite Slovenian scholars, students, and entrepreneurs from around the globe. So today we are hosting Mr. Marko Bitenc, founder and CEO of GenePlanet, one of the most prominent personal genetics companies in Europe, and co-founder of Universal Diagnostics, which aims to further primary prevention of cancer through the use of blood tests. Mr. Bitenc, we are honored to have the opportunity to speak with you today.
Thank you.
So let us start with the beginning of your entrepreneurial career. So you founded GenePlanet while studying at the Faculty of Biotechnology in Ljubljana at 22 years of age. You were also awarded several prizes in the field of entrepreneurship in the US, completed your Master of Science in the Netherlands, as well as studied at Singularity University in California. So my first question would be, how did all these experiences shape the beginning of your entrepreneurial career? And how would you compare these countries where you studied in terms of potential for biomedical entrepreneurship and its connection with academia?
So hello from my side as well. Thank you for the invitation. So I guess everything started when I was, in fact, I started studying in the faculty of biotechnical faculty in Ljubljana. Then first I went to Erasmus in Netherlands, and then I basically did a master's there afterwards. And I would say the IGM competition at MIT, this was something that for me it was maybe a trigger. Even prior to that, I wanted to do something. So this competition, IGM, it's basically where different universities all around the world compete. They basically work as a team during the summer, and then they had each team, in terms of synthetic biology, they basically produce certain project, certain product, perhaps at the end. And we were at the time competing with the University of Ljubljana in the field of health, where we did let's say a prototype for cell therapy against HIV. So if, for instance, the cells would get infected with HIV, then the basically your cells would trigger apoptosis, and they would basically commit suicide in a way, right? So basically, this was the time where I already started thinking, what can I do as an entrepreneur? What kind of company I could build? And then basically, while I was studying in Netherlands, I was at the time doing a master's in cellular molecular biotechnology. I remember that I just, you were young and you were not thinking a lot, but you just did certain things. And I remember I went home. We had this 1 week of holidays, and I just founded a company at that time. So this was in winter holidays, I think in February. And this is how it started. Yeah. So I would say all of these institutions or the, let's say, experiences that I had, they're all a bit different, right? So Slovenia has a different system in terms of education than Netherlands. I would say the main differences are that in Netherlands, it's a lot more connected to the industry. So you are a part of the curriculum is basically working on actual problems that are in cooperation with certain companies. So this is already done, even on a bachelor level, but then on the master's level for sure. I think that's quite different than, at least in my time, was in Slovenia. Then, of course, I would say that every time a student or a person is in contact with, 30, 40, 50 different nationalities, that it helps, especially for the entrepreneurial part. So I guess my entire life as a student, first I went to Netherlands, then we had this competition in the US. Then then I went to study at Singularity University. So these were all this was all environment where you were where your classmates were basically all foreign, and I guess as a consequence, it's a bit easier to think as well more in a global way. You know, so of course, having a company or building a company from Slovenia where the market is 2 million people, it's impossible. So I think at the moment our sales is a lot more than 90% abroad. And it's impossible to succeed just because the market is too small, which is fine. So if you're a student and you're always somehow involved in international environment, that's maybe a bit easier for you to think globally, to think a bit outside of the borders.
If we turn towards the company itself a little bit now, so GenePlanet is renowned for its personal genetic services and products, and I would like to ask you a bit about, if you could talk a bit about how and when the company managed to achieve such impressive growth, and what was and is the strategy used in your business model?
Strategy, trial and error. In many cases, I know it sounds stupid, but we failed so many times that eventually it just had to work. Many times people ask me, what's the, I don't know, personal trait that is really important, and maybe it's not a good translation, stubbornness, or but you just don't say no for an answer, and you try and try and try until it works. So from a company development point of view, I guess first 5-6 years this was a lot of struggle. We were struggling with how to pay the salaries, how to get the right people in the company, how to convince I don't know, other big companies, clients, hospitals, insurance companies, big institutions to work with us. You start as a student, you don't have a track record, so you just have to try so many times. You have to try hard, you have to work. Eventually, I would say eventually, once you really give your life for a certain thing, eventually it brings results. So, and this was also the case for us. So maybe first 5-6 years it was a lot of struggle, but then slowly and slowly and slowly we were picking up with sales. We were building a bigger team, and then I guess already around, when we were like 6-7 years old, and we were already present in maybe 10 countries. At the moment, the company sells in around 35 countries around the world. We have almost 200 employees, around 50 people work in R&D and product development. So that's quite a lot. And I would say that we are not a typical story that we would compare ourselves to companies from Silicon Valley, where you put a lot of money in the company and then spend a lot of money and hope that you will generate a lot of revenues and that it will be worthwhile. But then our case was more or less of an organic growth, and we basically went small steps at a time. But now the company, we will celebrate the 15th anniversary in a couple of months, and yeah, here we are. We are still growing, and we still have quite ambitious plans for the future. So yeah, let's see.
Right at the end, when you said ambitious plans, so like maybe in connection with this, I would ask you, what do you consider to be the main goal of your company, of GenePlanet, and like has it changed in any way throughout the years?
Yeah, well, of course it changes a bit. The mission of GenePlanet is to democratize genetic testing, and that every individual will be able to know what is written in their genes in a way. So, and and basically in your genes you have the instruction manual for your body, right? So from what kind of food do you tolerate, what kind of food is beneficial for you, how do you metabolize certain food, vitamins, minerals, how do you react to even sun sensitivity. So all of these traits are written in your genes, how you look like, how you metabolize medicines, what is your disease susceptibility. So all of these things are in a way encoded in your DNA. And our goal is that we democratize this information, that everyone could, in an informative and easy to understand way, could use this information to improve their well-being and health. So of course, when company develops, you expand this mission. You maybe go into a certain niche more than the other. So we are of course evolving in this perspective as well. Lately, we really are transitioning the company from more of a biotech company towards a big data company, right? So generally, what we see where the field is going, everybody understands the Moore's law, and basically the Moore's law is that the number of transistors basically increased every 18 months. In plain words, that basically, each 18 months you had let's say that your computer was twice as powerful as 18 months before. And then you look at genomics and try to compare, and we know that IT industry, microchip industry, this changed the world. If you think, now we have, phones, watches, cars, everything is connected all the time, right? You use your mobile phone practically the entire day. And then when you look at the comparison between genomics and the IT industry, you see that the pace of progress is even faster in genomics, right? So when in fact in the past we were looking at how can we most effectively sequence the genome, now we are looking at the next 5 to 10 years. How can we use the data that we generate with this genome, right? So that's why we are saying we are doing transition to a big data company. And if you just for a comparison, right? Let's say YouTube. Everybody knows YouTube. There are millions and millions of videos being uploaded each year. And for instance, when you look at the projection for 2025, you will see basically that, I don't know, or around this year that YouTube will generate maybe 2,000 petabytes per year, right? Whereas genomics, it can be up to 40,000 petabytes per year. So when we are talking about big data, definitely genomics is here one of the bigger problems in this perspective, right? So having said all of these things, we believe that the genomics as such will grow even faster in the future. That we will be able to do a lot of things in the medicine as everyone will at the end have the genome, and not only one time. You will also have tests like liquid biopsy, where you will also detect what is happening in your body at the moment, not only what is your predisposition when you were born. So I would say when you're comparing all of these things, for us, it's a pretty exciting time, and we still have a lot of things to do in the next 5 to 10 years.
Staying with the theme of GenePlanet for a while, in general, which products or let's say services it offers do you consider the most innovative, and are there any significant interests or significant differences in interest for your products between different parts of the world?
Of course. For instance, a part of the products are more connected to a lifestyle, or for instance, ancestry information. And when you look at the interest for ancestry information, it's a lot higher in United States compared to, for instance, Europe. Because, for instance, people move to United States, everybody has grandparents that are basically came to US. They don't know where they came from. So I would say this is one of the products that is perhaps more of an interest from the people in the US than in Europe. But then you also have different products, and I would say it's not such a big Europe-wide, or for instance, it's not such a big difference in adoption in Europe and US. Maybe there's a little bit of a lower adoption in some Asian countries for certain health-related tests. But I don't see a big difference overall. So I would say maybe ancestry information is one of the tests that stands out in US. Other than that, it's I don't see a geographical difference in this perspective.
What do you consider, like, which services would you say do you consider the most innovative or the most, let's say, significant in your
So
view?
we have a couple of products where we have a really good products. On one side, GenePlanet developed what we call a health intelligence platform, and it's practically unique. So you have several companies around the world that offer genetic tests, right? They offer DNA tests, but usually what they do is they offer what we call a targeted DNA test, meaning you want to have I don't know, information about ancestry, you do this test. And then, imagine you want to have now another test that is connected to nutrition. Then you have to, give a DNA sample again. This is usually just a saliva or a swab sample that you do from the comfort of your home. But anyhow, then you want another test. You want, and then you need to redo the test. And then maybe you would want to have, I don't know, a cancer screen, which is to check for hereditary mutations. How predisposed are you to cancer? And then you need to do it third time. So what GenePlanet is doing differently is that practically in a single test we sequence the whole genome. So at the end you do the test once and you have the information for a lifetime, right? So that's quite and we generate in certain medical products even 100 gigabytes of data per individual, right? This is one layer of information. Then the second layer of information is that at the same time we also detect basically your microbiome in a saliva, because for our test to work you give a saliva sample and we can detect also what kind of microorganisms, in some cases we can detect in a saliva whether you have a herpes virus or not, for instance. Then the second layer of information is that we use what we have a blood module, so we track in time how were your blood markers basically change within a certain time frame. Like, I don't know, in the last 2 years, you did a blood test every 3 to 6 months, and then basically you are able to track, and you also get, of course, the recommendations how you can improve certain markers. I don't know whether these are cardiovascular related markers or any other. And then the third layer is basically a link with your smart devices. So we have an app on Android and iOS, and this is linked to smart devices like Apple Watch, phones, whether this is Apple or Android, doesn't matter. So you have these multiple layers of different information, and by gathering all of this data, we believe that in the future we will be able to really create a lot of value already from the data mining, but also we are now starting to work also with certain pharmaceutical companies, and hopefully this will be we will have certain partnerships within the next 2 years. And just the entire system, it's now built that we will really work with a huge amount of data, and that basically we will be able to extract health related topics which maybe no one else discovered them so far. Let's see. That I would say it's maybe the main part. But then again, we also are now in a pilot phase. We have developed a pharmacogenetic test, which basically it's built on a combination between exome and whole genome. And here is again the rationale is that you can do it once, and practically every time there's a new correlation between a certain medicine and the reaction of the dose or the type of the medicines that meet, or how do we metabolize certain medicine. Whenever there's a new study that comes out, it's only a click of a button for us, because we already have the entire genome and all the information. And then basically you will get an upgrade on your app. I will tell you, okay, today we are giving you a new analysis. How do you, for instance, would metabolize this medicine? How this would affect you, whether we recommend it or not? And in this, in terms of pharmacogenetics, this is basically all based on clinical guidelines, which medical doctors basically provide. So all the information that we give is basically based on accepted medical guidelines, right? So on top of that, we are also, and this is a pilot phase, this is not on the market yet, but basically we have developed also, let's say, a QR or a barcode scanner, where basically you will be able to scan any medicine or any food supplement, and this will be then assessed whether how you metabolize these things based on your genome and other biological information. So these are certain things that are really now in the final phase of developments, and we are quite enthusiastic about them. So let's see how the next years will develop in terms of adoption of our new products.
So after already achieving success with GenePlanet, you also co-founded the company Universal Diagnostics in 2012. So why did you decide to pursue an additional entrepreneurial path, and how do you see the future of both of these companies comparatively speaking?
Yeah, so it's true. I co-founded Universal Diagnostics in 2012. In fact, I did it with a friend from which I've met basically, which was a friend who was studying with me at Singularity University in California. So we were then on Singularity University in NASA Ames, and we decided to do something about it. But the story is a bit more complex, I would say. So when you're thinking from a perspective, what causes that people actually die, right? So there are two main reasons why people die. So the number one cause is cardiovascular disease, and the number two cause is basically cancer. And with GenePlanet, it's a really effective tool how to prevent cardiovascular disease development. Whereas only understanding that you have certain risks for cancer, it's a bit limited in this way. And therefore, basically the reason was, how can you prevent people from dying from cancer? And the rationale here is, okay, what can you do? The only thing that is really effective, and before I continue, think about it from this perspective. When you look at the medicine in the last 50, 60, 70 years, there was a lot of progress that was done on cardiovascular diseases, and the mortality rates are way lower. Of course, there was a lot of progress done in cancer as well, but slightly less. So essentially, then I was thinking, okay, what can you do in terms of improving the outcomes, for instance, for people who get cancer? And the logic behind this, if you detect cancer early, when it's still small, or even at the precancerous state, when it's still small and treatable, then the survival rate of such patients is above 90%, for instance. And where you have a late stage cancer, like metastatic cancer, then it's only maybe 10-15%. So this was the idea and story behind Universal Diagnostics, where we basically, our goal is that the first product that we bring to the market is a test is a test for colorectal cancer. And the idea is, if you can detect colorectal cancer at a stage 1, or even at an earlier stage where you have basically adenomas, where you have polyps, and then in fact, if you detect it at this stage, you can even prevent cancer. But the goal is that you detect it as early as possible, and by doing this, with early detection, you will have a survival rate of patients with cancer which will be 90% plus. And then imagine if you can then shift let's say a high degree of population from the third and fourth stage of cancer to the first, or even at precancerous stage, then you can really do a lot in terms of how many people survive from a given cancer. So that's how the story started. On one side, we had our GenePlanet, which was our goal was to really prevent people from cardiovascular diseases, and then with UDX is a story that it's prevent people from dying from cancer. So that's how these two companies combine.
We all know the field of personal genetics is a fast-growing field all around the globe. And do you believe that it has the potential to achieve, or has it already achieved anywhere, the status of an important supplementation to so-called clinical medicine? And as such, how will preventive medicine as a whole change due to companies such as yours?
Yeah, of course. If you look at it, what was 15 years ago, what was 10 years ago, 5, and now, and you see a very steady pace. You see a more and more and higher and higher adoption, basically, of DNA tests in medicine. So either this is again going from cardiovascular diseases to cancer. Then you also have psychiatry. You have, for instance, pharmacogenetics is widely used. So which medicine you should take and which one not, or what kind of dose of a medicine based on your DNA profile you should take. So this is already used in clinical practice. Then you have the famous story of Angelina Jolie, where basically she was positive for a BRCA mutation and therefore did a mastectomy. So you have a variety of different DNA tests. Also, you have, I don't know, it's widely used also non-invasive prenatal test for pregnant women, where they basically with a blood test from a mother, you also detect whether a child has any aneuploidies, such as, I don't know, Down syndrome is very well known. You have quite a lot of clinical grade tests in clinical practice already as we speak, and this will only continue, right? So it will be genomics in such a way it will be more and more adopted in the coming years.
Could there be potential privacy issues concerning data gathered about customers? What is your opinion on that?
Of course, this is a sensitive information. In our company, we basically take this very serious. Therefore, we also did an ISO standard 27001. This is the data. It's a basically ISO standard connected to data protection. So we have quite a strong protocol who basically can access the data, etc. So I would say that as a company, you have to take this serious, and I think all of the companies in our field basically they are taking this very serious. And up to now, we didn't have problems with treating data as a confidential.
So touching a bit about on the connection with the so-called clinical medicine, to what extent do both of these companies cooperate with academic experts in the field of biomedicine or clinical medicine?
So both companies basically collaborate with universities, hospitals, etc. So I would say GenePlanet collaborates more on the actual clinical tests because it's already on the market for a significant amount of time. I think we have probably around 2,000 contracts worldwide with clinical centers, with hospitals, and related institutions. We also have several R&D products which are ongoing, and of course, it's a lot easier if you get a domain expert from university or from university clinic or any other similar institution. So we do this. Whereas for Universal Diagnostics, in this case, it's a lot of collaborations with hospital as well and universities for R&D. So I would say you have a connection with Stanford University and several other universities, basically from Spain, UK, Germany, etc. So I would say both companies are cooperating with academia. However, at the end of the day, when you have to build a product, you have to build a product. That's a fact, and this is in several cases it's a different way of working than in academia. Of course, you can do certain things together, but then again, when you have to bring the product to the market, this you have to do as a company.
So lastly, it must be said that GenePlanet is certainly a success story. In your view, does Slovenia have the potential for another such success story, and what could be done to improve and enhance opportunities for similar companies in the future?
Of course, it has a potential. There are several companies, great companies, in fact, in Slovenia. I would say what is the same with all of these companies that somehow succeeded was that they were really oriented towards outside, so globally oriented, right? I think the fact is that we are 2 million people, and that it's practically impossible to really succeed only in such a small market. For me, I don't know whether I think for me the biggest let's say advantage was that I was always either studying abroad or went abroad. I think this was the difference. And of course, Erasmus as a student, if you go to Erasmus, you can have fun, but at the same time you can also learn many useful things. You can meet new people. It gives you a certain other let's say advantages, because my entrepreneurial let's say job or role or life started very young while I was a student, so maybe this was the reason. But when we are talking to maybe there are people who started at a later age, I would say what is really good in Slovenia is this so-called certain, you can get certain subsidies for starting a company. This I remember, maybe in the first 2-3 years, it really helped a lot. It really helped a lot that we were able to get some grants from certain governmental institutions. So I would say that this played a big role. Today, not anymore. Today we are basically we outgrew this, but it's still helpful if you can get something like this in Slovenia, right? I would say where Slovenia is probably lacking is venture capital. You have a lot more VCs in other countries. I would also say that perhaps while studying, it's not connected enough to the real world. It's more of a theoretical approach, but maybe this has changed in the last 10 years. I hope so. But then again, so it depends where you want to live as well. So maybe we would be already years ago a unicorn if we would be stationed in California or Boston. But then again, if you want to live in Slovenia, it's pretty nice. It's a nice let's say balance between let's say private life and work life. But to answer your question, what could Slovenia do better? I would say focus more on startups. I think there has been a lot of progress in the last years. I know that Technology Park in Ljubljana is doing great for companies. And generally, I think Slovenia has a bright future. Perhaps, maybe there could be some tax incentives, at least for the early stage companies and for high tech companies. There are certain tax incentives exist, but maybe they could be more. But then again, I would still say that Slovenia is limited in that we are 2 million people. You just have to go abroad. You just have to try your luck outside of Slovenia and then come back. I think this would be more important than what can Slovenia as a country do.
So as a summary, let's say, would you say that the business and educational environment in Slovenia overall inspired or limited your entrepreneurial path more? And could you give an example of a country that could perhaps serve as a role model in this area?
Yeah, I would say I wouldn't say it limited because I just went abroad, so it couldn't have limited. But in fact, as a country, you have of course you have US. That's another story. That's totally different. You have Silicon Valley or you have the East Coast. Then you also have in Europe you have certain hubs for startups. London really has a lot of investors' money. I don't know what will now happen with Brexit or if there will be a decrease in coming years. Then in Israel, it's a country that I think is second or third based on the amount of startups or high tech startups they basically produce. So these are certain hubs that we know that work. So I would just replicate this model if I would be in the position to do so.
We've come to the end of our conversation. We enjoyed this illuminating conversation very much. We wish you all the best in the future and that all your aspirations come true. And thank you again for taking the time to speak with us.
Thank you. It was a pleasure.
So, dear listeners, we thank you as well for joining us today. And as always, you are kindly invited to tune in to the next episode.